Welcome to episode 2 of the ARC KSS Academy Top Tips series. This episode covers searching the literature, providing you with tips, strategies and sources of information for your literature research, and it's aimed at health and social care researchers in our region. My name's Melanie Rees-Roberts and I'm the Research Programme Manager for the ARC, and I'll be taking you through our tips today. And I would like to say thank you to Anna Peckham for creating the content and these slides. And she's the research librarian for the Centre for Health Services Studies at the University of Kent. So to start with, top tip 1, preparation is key. So what type of study are you doing? This will determine the scope, design and comprehensiveness of your literature search. Whether it is for a full systematic review, a preliminary scoping study or project, the same step-by-step approach to literature searching can be applied. The most important thing is to take a systematic approach. The literature search process is part of the research methodology, so being systematic about it throughout will help you with later documentation. Another important thing to consider is which databases you will use. A good literature search needs to be run across several databases to maximize coverage. The selection will depend on subject area and availability, but most commonly used databases include those listed here on the slide. Top tip 2, understand your research question. Perhaps the most important part of a literature search is spending time thinking about and developing the question. It needs to be clearly defined, relatively simple and focused. Remind yourself of the question frequently when designing your research strategy. It's important to set clear inclusion and exclusion criteria from the outset to ensure that your search is focused on the study question in particular and it does not generate unmanageable amounts of material. Limits might include dates, publication type, country limits, language, or age limits. Are you looking for everything or limiting your results to specific types of publications, such as peer-reviewed journals? Knowing what you don't want is a very good place to start, and ensure you are open to reviewing and revising during the search process to get the best results. Top tip 3, split your search question into concepts. Break the research question down into key concepts. Apply these concepts to a framework such as PICO, stands for Population Intervention Comparator Outcome, or PO, Population Exposure Outcome, or a similar structure to help your search strategy. It's not always possible to format the question to exactly fit all the different frameworks, but modify to suit your particular study. For example, a research question might be how to prevent the spread of COVID-19 in care homes for older people. And this could be broken down into the following concepts. Concept 1, population or who, and in this case, it would be older people. Concept 2, setting or where. So for this example, that would be care homes. Concept 3, what's the context, the what. And here we are looking at the spread of COVID-19. And concept 4, what's your intervention? How will you address the problem? So for this example, you might search for infection control. And together, your concepts will form sets within which your search terms are developed and combined. Top tip 4, select keywords. Identify keywords, terms, and exact phrases that best define the key aspects of the research question. Create a table or list and place these terms within your concepts or sets. When choosing terms, think of synonyms and different ways of expressing a concept. For example, a study on general practice would need to include many other terms to capture the literature, such as family practice or primary care. American terminology can differ from UK terminology in some subject areas, so do take this into account. Certain words can be unhelpful as search terms, so try to avoid words such as evaluation, advantages, disadvantages, best, worst, compare, because these may skew the search, resulting in relevant papers being missed. Look at key papers which contain author keywords and also the database subject headings that they have been ascribed. Spending time testing out individual terms on Medline or another database to see what other terms are used and what results they generate will help. Build and modify the search terms within your concepts or sets. Top tip 5. Use text words and subject headings. Your search strategy should contain a combination of text words, or sometimes called free text terms, and their synonyms. Rather than the full document, this is usually restricted to the title and abstract fields. In Medline and other databases, this needs to be specified by adding the appropriate abbreviation after the term, such as TI or AB. In addition to your key text words, a search strategy should also include subject headings. These are controlled vocabulary terms to describe the subject of an article. Medline uses mesh terms, for example, medical subject headings, and will map your word to the most relevant subject heading. You can browse a subject headings list and check definitions and narrower or broader terms in the subject tree. By exploring subject headings, additional useful terms can be discovered. Note that subject headings do vary between databases. Mesh terms can also be exploded, which means that all narrower terms are also included in your search. Exploding the mesh term cardiovascular diseases, for example, will generate a long list of specific conditions and diseases, allowing you to be quite specific or to generalize by including them all. Mesh terms contain a scope note, which gives a definition of the term and can be used when unsure about precise meanings. Top tip 6, combine your search terms and concepts. To combine keywords, synonyms, subject headings, and search concepts into a workable strategy, the use of Boolean operators is necessary. These are the or, and, not operators used to combine terms and concepts in your search. All the major databases use them. For example, the OR command is used to broaden your search. Terms, synonyms, and subject headings can be combined using the OR operator, and this will retrieve references containing some or all of these search terms. It is used to group similar words together, so the more the OR operator is applied, the greater the number of references retrieved. The AND command is used to limit your search to only those references containing both specific terms or concepts. This will retrieve references where both search concepts are present. Heart disease synonyms and smoking is a good example. Using the AND operator restricts references. The NOT command is used less often and specifies that a term must not be present in retrieved papers. It is a way of excluding references. The following diagrams give a visual representation of how Boolean operators work. For example, AND will retrieve only articles with both terms present, but the OR word will retrieve articles with one or both terms present. So looking at our previous example, you can combine the concepts with Boolean operators. For example, each concept might have a number of synonyms or concepts that can be combined using OR, and then the different concepts linked with an AND operator. Top tip 7, search techniques and symbols. Most databases have an advanced search option. This is recommended as it allows more detailed search combinations and will map terms to subject headings. Most databases have a range of searchable fields. Exact phrases will need to be enclosed in quotation marks. Truncation is usually represented by an asterisk symbol, but can vary between databases. It ensures all possible endings of your term are identified in addition to plurals. For example, diet asterisks will retrieve records containing the words diet, diets, and dietary. Wildcard symbols allow alternative spellings to be found, and this can be particularly useful for American spellings, for example, with the word organization. Proximity searching enables a search for two or more terms that occur within a specified number of words from each other. So searching for locum adjacent within 3 words of doctor will find both locum and doctor within 3 words of each other and in any order. Top tip 8, test your search. To find out if you have an effective search strategy, it is advisable to carry out a test or pilot search before going further. This is to determine which combinations of search terms work best to ensure that relevant references are retrieved. Identify a few key papers relevant to your research topic or check the reference list of a review. Then select a database. Medline is a good one because it's comprehensive. And then run your search strategy. Have all your pre-selected papers been retrieved? If they have, your search strategy works. but if not, your search strategy needs to be modified. Top tip 9, be prepared to modify your search. If any of your pre-selected key papers have not been retrieved, now is the time to review and modify the search strategy. To work out why the record has not been identified, check your search terms and how the terms have been entered. Are the spellings correct? Have the Boolean operators been used in the appropriate way? Not all papers are indexed in a logical way, and one paper may have different index terms from another despite being similar in content. Go to the database, check which subject headings, keywords, and terms have been used to index the papers you have pre-identified. Amend the search strategy accordingly so that your selected papers are retrieved. By checking terms and further exploring mesh subject headings, the search can be modified to ensure relevant papers are captured. When you are confident that your strategy is effective, apply it to other selected databases, but bear in mind it will need to be adapted for each. What if you get too much information, or maybe not enough? The downside of being as comprehensive as possible is that there may be too much information or the material is irrelevant. Look at your limits again to restrict results or further refine your terms and combinations of concepts. There needs to be a balance between limiting too much to increase specificity and being overwhelmed by material. If there are too few references, it could be because not much has been published on the topic, your limits may be too restrictive, or the search terms are not adequate. So spend time on testing out further iterations of your strategy before applying to other databases. Top tip 10, and definitely the most important, save and document your search. Start with your test search database and be careful to keep a record of the search results. Each database is different, so searching techniques will vary between them. Different platforms hosting the same database will also vary, for example, PubMed and Ovid Medline. Be prepared to adapt and tweak your strategy accordingly. There may be different subject headings, search fields, and limits depending on database or database provider. Most databases allow you to save your search. This is really important and can save time if you need to rerun the search at a later date. Do keep a copy of the search strategy for each database used. Remember to keep a note of the number of retrieved records from each database and record the date the search was conducted. You can manage your references by using bibliographic reference software such as EndNote, Mendeley, or Reference Manager. Most database references can be exported directly into your reference library, where they can be more easily sorted and deduplicated. Finally, it is really important to keep good records of each step of the search process, taking notes as you go. Documenting the search is part of the research methodology. You need to demonstrate that the search is structured in a systematic way, able to be reproduced, and any decisions made along the way are justified. Other sources of information that may be useful can be found here. Many academic libraries produce guides to help with literature searching, as do several health organisations, including the Royal Colleges. These provide useful information on literature searching generally and on technicalities of searching databases. Database providers also offer quite detailed help guides to their products. It is worth spending time going through some of these before starting your search, especially as databases differ from each other in commands, symbols, subject headings, and other features. A list of further resources can be found here, and we hope you enjoyed this top tip session.